Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. GERD, or heartburn as a lot of us refer to it, affects millions of people, but there are ways to deal with it and ways to identify it. So we're talking with gastroenterologist Marc Subik about that today, about how we can deal with GERD. What are the common symptoms of GERD?
Yeah, the typical symptom of GERD or heartburn is that acidy sensation that comes up into your chest. And that's fairly typical for heartburn. Sometimes you can have nausea with your heartburn. You can have increased salivation with it. We call water brash. But the typical one is the retrosternal burning that can occur frequently or very rarely, depending on the individual patient. Can be related to certain foods or not, or it can just occur spontaneously.
How debilitating can it be? How serious can it be?
It can be very serious depending on how often it occurs, obviously. There are people that have a typical heartburn, burning symptoms once or twice a month, and it's inconsequential. And there are other people that have heartburn on a daily basis. That sometimes they'll have it that wakes them from sleep, which is a worrisome problem, and symptomatology. So there's that scale of symptoms that it can present with.
Is there a specific population that's most at risk of GERD?
Well, I mean, it can occur in anyone, but if you're overweight, it increases your chance of being at risk for heartburn type symptoms. If you're a smoker, females a little bit more common, but diet doesn't really have too much to do with it. And once again, that is more of an individual presentation with that patient. That one patient may have heartburn type symptoms with a particular food that another patient may, the same food may not bother them. How
is GERD diagnosed?
Diagnosis is made basically on history with that typical retrosternal burning, and on that basis we'll begin to initiate some treatment based on the history, and then we'll evaluate the patient's response to standard simple treatment, and depending on how they do, we may need to intensify their treatment, or there may even need to be a role for an upper endoscopy to evaluate for any changes within the esophagus or the stomach.
How serious can it be? A lot of people are like, oh, it's just heartburn, but can it lead to some serious medical complications?
Yeah, that's a good question, because it can. And one of the things that I pay attention to is how long has the patient had history of reflux. The longer the patient has had reflux, and the longer they've been on treatment for reflux, there increases their odds of having changes in the lining of the esophagus, which can be precancer changes. Now that's called Barrett's esophagus, and it can be present in a small minority of reflux type patients who have had reflux for 10 years or so, with or without treatment, and those are patients that you would like to diagnose by the endoscope, because it is a pre-malignant condition. So that's one of the more serious problems that can evolve over many years of heartburn type symptoms. I mean, other problems that can evolve too, due to the inflammation, are narrowing, we call strictures. That's the other one. It's a major problem. Results in the sensation of food sticking at the end of the esophagus or in the middle of your chest.
Yeah, so just don't dismiss it entirely. You need to talk with your professional about it.
Certainly mention the fact that you're having heartburn, and you may be treating it yourself, because there's a lot of medications over the counter, whether that's antacids, whether that's an over-the-counter Pepcid or over-the-counter Prilosec or Omeprazole. A lot of people do that and avail themselves of that, and I think that's perfectly fine. But it is something you need to mention to your PCP so that they can explore that a little bit further and document those findings and keep that in your chart if there's any subsequent issues down the road.
Get the help that you need if it ends up with that. Dr. Subik, thank you so much. We appreciate your time today. Some great information.
Thank you.
Thanks for checking in for Monday Health Minutes.